Welcome back to the Best PT Podcast. This is episode 21, talking about hydrotherapeutic modalities. Starting with some basic properties of water. Buoyancy is the upward force that acts on the body when it is immersed in water equal to the water displaced by the body. Resistance. Water molecules continue to attract to each other, providing resistance surrounding a person in water. Specific gravity of water is 1.0. Humans are 0.974, so this is why people float in water, combined with the force of buoyancy. And then specific heat. Water has a specific heat of 1 calorie per gram, while air has a specific heat of 0.001 calories per gram. So water retains heat 1,000 times more easily than air. Drag. Water opposes movement in the opposite direction. Flow. We have laminar and turbulent flow. Laminar flow is fluid that follows a smooth path with slow flow rates. So think of like an above ground pool. And then turbulent flow rates. Fluid follows erratic current with whirlpool-like circles called eddy currents. So fast rushing river with rapids. Turbulent flow provides more resistance than laminar flow. And then common treatment temperatures. 32 to 79 degrees Fahrenheit is for acute inflammation of the distal extremities. 79 to 92 degrees is for exercise, so aquatic therapy. 92 to 96 degrees, wound care and spasticity. 96 to 98 degrees for cardiopulmonary compromise and burn treatments. 99 to 104 degrees, pain management. And 104 to 110 degrees, chronic arthritis, either rheumatoid or osteoarthritis, and for increasing range of motion. Hydrotherapy. Therapeutic effects: decreased tone, increased blood flow, pain relief, relaxation, vasodilation, wound debridement, and increased core temperature. Indications: arthritis, burn care, edema, decreased range of motion, desensitization of residual limbs following amputation, muscle spasticity, muscle strain, pain, sprains, and wound care. Contraindications: cardiopulmonary diseases, active bleeding, gangrene, maceration, or infections, diminished sense of sensation, impaired circulation, incontinence, or mental impairments. Different types of tanks for hydrotherapy. An extremity tank is a 10 to 45 gallon tank for the distal extremities. A lowboy tank is a 90 to 105 gallon tank that allows long sitting to the mid-thoracic level. A highboy tank is a 60 to 105 gallon tank that allows for sitting in chest-high water with the knees flexed. A Hubbard tank is a 425 gallon tank used for full-body immersion. Do not use a Hubbard tank with a patient with unstable blood pressure or incontinence. And finally, a regular pool is heated to 79 to 97 degrees. Whirlpools. A turbine in the whirlpool creates agitation in the whirlpool effect that provides agitation and aeration of the water. Treatment time is 10 to 30 minutes, and the tank must be cleaned after each and every use. Aquatic therapy allows for decreased weight bearing due to the force of buoyancy, enhanced control over resistance, and improved PT handling ability of a patient. In aquatic therapy, multiple sclerosis patients need a pool that is 81 to 83 degrees Fahrenheit so they do not overheat. Contrast baths involve using alternating hot and cold to decrease edema and desensitization to pain. So the hot water should be 104 to 106 degrees Fahrenheit and the cold water should be 50 to 60 degrees. Begin with the hot bath for 3 to 4 minutes of immersion, switch to cold for 1 minute, and then repeat this cycle for 25 to 30 minutes. That's it for episode 21, talking about hydrotherapeutic modalities. Episode 22, we'll talk about mechanical modalities. As always, the outline will be in the show notes. Thanks for joining.